Dr. Ronald Schweitzer, Low-carb versus medication results, Part 3. Dr. Schweitzer received a marketing brochure from an anti-diabetes medication company. It showed how well their medication performed versus another.
I thought, well, this is interesting. They're promoting this medication. It certainly works well. You know, a drop of 1.5% is pretty good. But one of the things I noticed in the graph is that 30 weeks it seems to be at its lowest, and then the HbA1c seem to be rising for both medications, yeah? And I thought, well, that's interesting, which is exactly what my endocrinology friend said happens. There's no complaints about this. You know, this is just what we expect. And the other thing that was interesting is that 20% discontinued treatment. One of the big criticisms of low carb is, but people don't stick on it. But 20% of people discontinued treatment, 10% due to adverse effects, and 42% developed gastro side effects, vomiting, nausea, etc., etc. So I thought, well, let's compare that to the low carb groups. And I think this graph looks somewhat better. And they're on less medications. And I should also mention the side effects that happen with low carb. You get less reflux, so you get less distention, less upset stomach. So some real significant side effects with the low carb group as well. Possible issues and biases of the audit. Not a randomised controlled trial, and this means that there's a bias in favour of the intervention, and patients choosing intervention are probably likely to be more motivated, and of course the doctor, that's me, is more motivated for patients choosing the intervention. But I still think it's reasonable to say that for people who are motivated, both the doctor and the patients, dietary carbohydrate restriction can make clinically important differences in HbA1c, number of anti-diabetic medications, and the number of patients with a non-diabetic HbA1c. And these findings are consistent with findings from larger clinical trials. I got an email just this morning from a patient, and I just thought, how lovely is this email? Hi Ron, I went clothes shopping today to a store that I would often struggle to fit into a size 26. Today I bought size 22. I couldn't believe it. I could even get into size 20. I'm so thrilled. Just wanted to share that with you, and thank you for being there for me, for your patience, encouragement and coaching.
Dr. Schweitzer received a marketing brochure from an anti-diabetes medication company. It showed how well their medication performed versus another. Their study showed an HbA1c drop of 1.5%. However, it was on the rise after 30 weeks, and 20% of the participants discontinued treatment, and 42% developed symptoms such as nausea, diarrhea, vomiting, abdominal pain. The patients on Dr. Schweitzer's low-carb diet, HbA1c also, but it continued to decline over time. Dr. Schweitzer does show side effects from the low-carb diet: less reflux, less abdominal distention, and less upset stomach. He notes possible issues and biases of the audit. It was not a randomized control trial. Some participants were able to choose the intervention. Of course, those are more likely to be motivated, and the doctor, of course, was motivated in this case. His conclusions: people who are motivated, a dietary carbohydrate restriction can make important differences in HbA1c, the number of anti-diabetic medications needed, and the number of patients with a non-diabetic HbA1c. He concludes with an email from a patient. The patient says, I went clothes shopping today. I normally struggle to fit into a 26. Today I bought a size 22. Thank you for being there for me.
Annotated and summarized. Easy to share with loved ones. The description below the title for this video has these summary points.